Good day everyone. Today, we will be discussing the different projections of the lower extremities, including the foot, ankle, leg, knee, and the femur. The first projection is the AP or apiation projection of the foot. First, place the patient seated or supine at the radiographic table and flex the knee on the affected side. Press the sole of the foot in the radiographic table. And center the plantar surface of the foot to the image receptor. And make sure that no rotation of the foot must be occur. For the AB projection, the central ray must be perpendicularly directed to the third metatarsal. And for the apiation projection, the central ray must be 10 degree posterior to the third metatarsal. The structure shown in this projection is a tarsal, metatarsal, and phalanges. The second projection of the foot is the AP oblique projection, medial rotation. First, sit the patient or in supine position on the radiographic table and flex the knee on the affected side. And place the plantar surface of the foot to the image receptor. Rotate the foot 30 degrees internally. And the central ray must be perpendicularly directed to the third metatarsal. The structure shown in this projection is the interspaces of the cuboid, calcaneus, and the fourth and fifth metatarsal. The third projection of the foot is the AP oblique projection, lateral rotation. First, place the patient at the radiographic table in seated or in supine position. Flex the knee on the affected side. And place the plantar surface of the foot to the image receptor. And rotate the foot 30 degrees externally. And the central ray must be perpendicularly directed to the third metatarsal. And the structure shown in this projection is the interspaces between first and second metatarsal and between medial and intermediate cuneiform. The projection of the foot is the lateral projection, mediolateral. Have the patient lie on the radiographic table and elevate the knee. And elevate the knee to place the patella perpendicular to the horizontal plane. Center the image receptor to the midfoot. And rotate the foot on the affected side. Dorsiflex the foot to 90 degrees. And the central ray must be perpendicularly directed to the midfoot. The structure shown in this projection is the entire foot, the distal end of the tibia and fibula. The sixth projection of the foot is the lateral projection, lateromedial weight-bearing method. First, have the patient in upright position and place the image receptor to the groove between the two blocks. And the central ray must be perpendicular above at the base of the third metatarsal. The structure shown in this projection is a longitudinal arc. And the next projection is the APHL weight-bearing composite method. Place the patient standing on the radiographic table and the affected foot placed forward, and the other foot is placed one step backward. For the first exposure, the central ray must be 15 degrees towards the heel at the base of the third metatarsal. And for the second exposure, the unaffected foot must place forward. And for the second exposure, the central ray must be angulated 25 degrees anteriorly and posterior to the ankle. The structure shown in this projection is the entire foot without the leg. Today, we will be discussing different projections of the ankle. The first projection is the AP projection. First, have the patient seated or in supine position on the radiographic table, and the affected limb must be fully extended. Place the ankle joint to anatomic position with the foot facing upward. And place the image receptor to the ankle. This is the true AP projection of the foot. And the central ray must be perpendicularly directed to the ankle joint. The structure shown in this projection is the distal end of tibia and fibula. The second projection of the ankle is the AP oblique mortise joint medial rotation. Have the patient seated or in supine position on the radiographic table and extend the knee. Place the image receptor to the ankle joint. Place the anatomic position of the ankle with the foot pointing upward. And rotate the foot by 15 to 20 degrees internally. And the central ray must be perpendicularly directed to the ankle joint. The structure shown in this projection is the entire mortise joint. The third projection of the ankle is the lateral projection, mediolateral and lateromedial. Have the patient seated or in supine position on the radiographic table and fully extend the knee. Place the image receptor to the ankle. Place the ankle in anatomic position with the foot facing upward. And rotate the ankle and rotate the foot to the affected side. And the central ray must be perpendicularly directed to the medial malleolus. And for the lateromedial, rotate the foot on an affected side. We can use sandbag for the knee of the patient for the support. And the central ray must be 1/2 inch superior to the lateral malleolus. The structure shown in this projection is the distal end of the third tibia and fibula. Today, we will be discussing the different projections of the leg. The first projection is the AP projection of the leg. First, have the patient in supine position and adjust the patient's pelvis so it is not rotated. Place the image receptor to the mid-leg. Center the mid-leg to the image receptor. And make sure that the foot is in vertical position. Para proper yung kanyang anatomy. And the central ray must be perpendicularly directed to the mid-leg. The structure shown in this projection is the tibia and fibula. The second projection is the lateral projection of the leg. Have the patient in supine position. And guys, para ma-obtain yung ating lateral position ng ating leg is pwede nating i-side yung ating patient. Since ang kukuhanan dito na part is yung ating affected side, which is yung right leg. So guys, the image receptor must be in the mid leg. Ganito yung ating position ng ating lateral. Kasi pag itong left foot ang nandito, is uncomfortable siya dun sa ating patient. And the central ray must be perpendicularly directed to the mid of the leg. The structure shown in this projection is tibia and fibula. The third projection of the leg is the AP oblique, medial rotation and lateral rotation. First, have the patient in supine position on the radiographic table. Place the image receptor to the mid leg. For the medial rotation, rotate the leg internally by 45 degrees. And the central ray must be perpendicularly directed to the mid leg. The structure shown in this projection is the distal fibula. And for the lateral rotation, rotate the leg externally by 45 degrees.
Okay ba? In-accept ko din.
The central ray must be perpendicularly directed to the mid leg. And the structure shown in this projection is the medial proximal distal of the tibiofibular articulation. And now, we will be discussing the different projections of the knee. The first projection is the PA projection Rosenberg method. Place the patient in standing position and instruct the patient to face the X-ray tube. Place the image receptor at the end of the radiographic table with the knee is in contact with the IR. Instruct the patient to slightly flex the knee. And the central ray must be horizontally and perpendicularly directed to the tibia and fibula. The structure shown in this projection is good for evaluation of the articular cartilage disease. The second projection of the knee is the lateral projection, mediolateral. Place the patient supine on the radiographic table and ask the patient to turn on the affected side. Place the image receptor to the knee. And flex the knee to 20 to 30 degrees. The central ray must be 1 inch distal to medial condyle at 5 to 7 degrees cephalad. The structure shown in this projection is the distal femur, patella, and the knee joint. The next projection is the PA axial home blood method. Instruct the patient to kneel the image receptor on the radiographic table, with the anterior surface of the knee is in contact with the IR. The central ray must be perpendicularly directed to the lower leg. The structure shown in this projection is the intercondylar fossa and medial and lateral intercondylar. The next projection is a PA axial Camp Coventry method. Place the patient prone on the radiographic table. And place the knee on the image receptor. Instruct the patient to flex the knee by 40 to 50 degrees. The central ray must be perpendicular to the leg at 40 to 50 degrees caudally. The structure shown in this projection is the intercondylar fossa, medial and lateral intercondylar tubercles. The next projection is a tangential projection, Setagas method or the skyline view. Place the patient prone in the radiographic table. Flex the knee as much as possible until the patella is perpendicular to the image receptor. The central ray must be perpendicular to the joint space by 15 to 20 degrees towards the knees. The structure shown in this projection is good for evaluation of the vertical fracture of the bone. Now, we will be discussing the different projections of the femur. Place the patient in supine position on the radiographic table and ensure that the pelvis is not rotated. Place the IR to the mid of the femur. And rotate the leg by 10 to 15 degrees internally. The central ray must be perpendicular to the mid of the femur. The structure shown in this projection is the femur and the femoral neck. Next projection is the lateral projection, mediolateral. Place the patient in supine position on the radiographic table and instruct the patient to turn on the affected side. Place the image receptor at the mid of the femur and flex the knee to 45 degrees. And the central ray must be perpendicular to the mid of femur. The structure shown in this projection is a 3/4 of femur and the adjacent femur. Okay.